Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 40 new cases of COVID-19, bringing our total to 167. The total number of deaths as of this morning remains at 1. 5 individuals are currently hospitalized. 4 of those are in intensive care. We are reporting 11 individuals that are listed as recovered. Public health investigations are continuing to confirm details, and information will be updated on the website daily as it becomes available. Yesterday, Chatham Provincial Lab performed 1,300 tests, bringing the total to date to 11,327. I'm pleased to report that there is no longer a backlog at Chatham Lab for testing at this time. The turnaround time is now within 24 to 48 hours from when the test arrives at the lab. I want to thank everyone at Chatham Lab for their professionalism and their hard work in our response to COVID-19. Work continues to ensure that all those who have been tested will receive their results as soon as possible. Public Health is investigating a respiratory illness outbreak in a personal care home after a healthcare worker tested positive for COVID-19. Currently, 9 patients at the Bedell personal care home in Gimli are showing symptoms of respiratory illness. The site has tested all symptomatic clients to determine the cause of the outbreak, which includes testing for COVID-19. The site has implemented appropriate infection control and prevention processes to isolate affected patients and prevent further spread. We'll be monitoring this situation closely. As the number of cases increase, I'm reminding Manitobans of our first COVID-19 clinical trial testing the drug hydroxychloroquine to see if it is effective in treating and preventing the onset of COVID-19. Manitobans who are eligible and who wish to participate in the clinical trial can visit covid-19research.ca for additional details. I want to note that the public health orders that are currently in effect do not apply to federal, provincial, or municipal governments. And this is including any work needed to address spring flooding and any current issues in that regard. It's likely that sandbagging will be required and that work can and must continue. Certainly people who are undertaking that work, and including volunteers, are advising to take precautions such as washing your hands regularly, avoid touching your hands and face, and certainly stay home when you're ill. We continue to ask people to take significant precautions and continue to enhance our messaging regarding social distancing because we want to ensure that people are aware that once we see this virus in the community in low levels, it's possible to acquire that virus should we not practice our social distancing. Most important message, stay home. Stay home if you can. It limits your risk to acquiring this virus. It limits the risk to others of spreading this virus. So stay home as much as you can. That would be your biggest contribution to decreasing the spread of this virus. If you must go out for only essential reasons. Go out alone if you can, and adhere to strict social distancing strategies when you're out. Maintain that 2-meter isolation from other individuals. Frequently wash your hands. Cough into your sleeve and sneeze into your sleeve, but even better, stay home if you're having any symptoms. This includes our healthcare workers. Even mild symptoms are important. Stay home if you're ill. It's a big contribution you'll be providing to Manitobans if you stay home when you're ill. I want to remind Manitobans that certainly during this pandemic, this virus is on most people's minds, but there are other medical conditions that people are dealing with, and I want to ensure that individuals keep in touch with their healthcare providers and ensure they're on top of their current medical conditions. Many visits can be done virtually, but we should take the opinion of your healthcare provider on whether you need to be assessed in person or virtually, or any changes to your treatment plans. So please keep in touch with your healthcare providers. This virus is on everyone's mind, but don't lose track of your current health issues. They are very important as well. I want to encourage Manitobans to look for credible information. Please visit our website at manitoba.ca COVID-19 for up-to-date information about the virus. I want all Manitobans to continue to know their role, to know that none of us are helpless against this virus. If we all do our part, we can interrupt the transmission of this virus, flatten that curve. Stay home. Stay home is your best option. If you must go out for essentials, then practice and adhere to social distancing strategies the entire time. This is especially true for those in vulnerable groups, those over age 65, those with underlying medical conditions, or those with immune compromise. Stay home, protect yourself. This is not the time for travel. Even for leisure travel, such as to cottages and such, now is the time to stay home. We know there's lots of reasons to not travel at this time. It's more difficult to adhere to social distancing strategies. If you're out in rural or remote areas, that could potentially put excess strain on those communities if you did fall ill. So now is not the time to travel. Now is the time to stay home, to flatten the curve. And so I want to thank all Manitobans who are already doing their parts. Many Manitobans have contributed and continue to contribute in many ways. And together, we're going to flatten this curve, but we need everyone to start, and everyone to start now. Stay home, social distancing, and thanks again. I'll pass it over to Lanette.
Thank you. Good afternoon. I want to begin today by thanking the Winnipeg Free Press, who has a long history of stepping up to support the community and the province. Today is no different. The newspaper has donated a significant amount of advertising space to us to support this cause, and the generous donation will allow us to direct more Manitobans to the information and resources they require to manage this COVID-19 in the days and weeks ahead. So contributions like this are invaluable, and we thank the Free Press for their partnership and for their commitment to helping the community and the province. In terms of operational matters today, the online assessment tool garnered nearly 8,000 web views yesterday. Since launching more than 2 weeks ago, the French and English versions have seen 370,000 visits to the site. Dynacare continues to call patients who have negative test results, and on Wednesday they made approximately 750 calls. As a reminder, people who test positive for COVID-19 are contacted immediately by public health officials. In terms of community testing sites, a second drive-up screening site will be opening on Friday at the Main Street MPI Service Center. The hours of operation will be Monday through Sunday, 7 days a week, 9 to 5. The other Winnipeg locations that are dedicated to COVID-19 testing include Mount Carmel Clinic, Access Winnipeg West, and the MPI's Bison Drive Service Center in Fort Garry. This new Main Street location will now allow Access Transcona and Access Fort Garry to return to their primary mandate, which is to provide care to the primary patients as well as episodic situations. So starting tomorrow, Access Transcona and Access Fort Garry will no longer be COVID-19 testing sites. As a reminder, these community testing sites are not walk-in clinics. A referral is required to attend. On another note regarding PPE, the healthcare workers in facilities, including hospitals, long-term care facilities, access centers, and COVID-19 testing sites will begin wearing procedure masks and other personal protective equipment during all contact with patients. We are working on the detailed implementation of this change at sites across the province, and we'll make sure that we support regions and facilities and staff to ensure that they have the appropriate equipment to keep them safe. More information will be shared with healthcare providers later today. We had planned for this eventuality, and the escalation of cases in recent days at healthcare facilities means that it is time for us to begin implementing this change in addition to our normal infection prevention and control protocols. We know that there are often lots of questions generated by the speed at which we're being forced to adapt our processes and protocols. We continue to ask healthcare workers to raise any questions they may have with their managers, and we will continue working to provide the answers as quickly as we can. As Dr. Roussin noted, there are several new cases at healthcare facilities today involving staff, both at HSC Winnipeg and Bettle Home in Gimli. Any healthcare workers determined to have had close contact with the individuals who tested positive are being identified and receiving direction from occupational health services and public health. Patients and residents identified as having close contact with these positive cases have been moved to isolation rooms, and those with symptoms are being tested for the virus. These cases cause us all a great deal of concern, and we cannot emphasize enough the responsibility that all Manitobans have to do what we can to slow the spread of this virus. We should stay home as much as we can, but we must really stay home when we're sick and even when those symptoms are mild. We must use social distancing strategies to prevent prolonged close contact with other individuals, and we must employ proper hand hygiene. All of us, including healthcare workers, are depending on one another. And finally, we know what impact COVID-19 has had on healthcare workers around the world. And in the last few days, the true reality of what's happened elsewhere is starting to be felt here in Manitoba. And we know everything about this is hard, and not just on the workers themselves, but on their loved ones too. Dr. Roussin and I received a letter yesterday from the spouse of a healthcare worker, and with permission, I will read an excerpt of that email. The writer said, "She awakes in the morning with a smile, and we are on our way out the door. She jumps out of the vehicle, says goodbye, and heads into a world where we have no control over. She does her job with care and compassion and forgets to eat or take a break. Some days she gets home after incredible hours, says she hasn't even had time to go to the bathroom that day. We sat at the table last evening and I asked her not to go to work. Stay here, I said, where you can isolate and stay safe. I knew there was no chance. She had an obligation to all of you to keep you safe and healthy, even if it's at her expense. That's who she is, and that's what she chooses to do. Now this virus has started to hit the hospital staff. Our frontline workers are not immune. And while the rest of you are asked to stay safe, to stay in your homes, to isolate and to social distance, she has to do the opposite. We hear again today about people not taking this seriously. God forbid that any of you get stricken with this virus, but if you do, the nurses and doctors will treat you with respect and dignity, and nothing will be spared to help you get better. That's their promise to you. So I want to say thank you very much for that letter and those powerful words. It was very well said. And with that, we will open the line to questions.
Thank you. It is time for questions. A reminder to our reporter group today, you get a primary question followed by a follow-up question, and please introduce yourself before you ask your questions. From CBC Radio Canada, Ezra.
Hi, my name is Ezra Belot-Cuisino from CBC Radio Canada. I would like to know if there has been more now with the reagents you guys needed to proceed to more tests. Where are we? Do we have more of that chemical produce to make more tests right now?
I've been working, effortlessly, really to try to get reagent, all the products that are needed. There's a number of steps that need to be taken to increase our testing volumes. So that includes swabs, it includes viral transport media, includes the reagent, includes the technology. And so you can see the numbers are steadily climbing. 1,300 tests done yesterday. They've managed to work right through their backlog now. So that's we're looking at having that capacity continue to increase over time. But they've done such an amazing job to get us where we are, get us through this backlog, 1,300 tests in a single day, and we're expecting that number to hold steady and even increase over the next number of weeks.
Okay, so I understand that the situation is getting better. Although as of now, like let's say today, do you consider that Manitoba is in a position of shortage concerning all those equipment you mentioned, or are we okay in our own strategy of testing and all?
Yeah, I think we've expanded our testing. We've now increased testing to all symptomatic healthcare workers. Testing in First Nations are our priority, testing in congregate settings as well. So we've been able to expand our testing. We're going to continue to do so as the capacity increases, but also as the needs increase, as we're seeing more community transmission. So I think that the lab, the people at CADM Provincial Lab have put us in a very good position for our testing capabilities.
Thank you, sir.
From CTV Winnipeg, Michelle.
Hi, it's Michelle from CTV. Have you heard of any other possible investigations at long-term care facilities? Riverview Health Center is one that we've been hearing.
Right. So I've was made aware of a case, but because of the very strict social distancing strategies that were in place, there in fact was no other clients exposed. So I'm aware of a case, but because of the strict adherence they had at the time, there was no other clients being exposed. So that investigation, as far as clients go, is done.
Sorry, that was the Riverview Health Center?
Correct.
Okay, and then as a follow-up, we've seen a lot of lineup outside certain shift chains at hospitals. Was this expected, and are you going to be doing anything to kind of get people in the door a little bit quicker?
Yeah, so I would say that today is the first day that we implemented those screening protocols for all staff, and with every change, there's often some details and processes to be worked out. So we will continue to work with the leadership at the site to see how we can streamline that and make it flow a little quicker and a little more efficiently.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. We're getting some numbers from various healthcare worker unions about the number of workers who were sent home and told to self-isolate at HSC. Can you tell us how many workers have been sent home, what percentage of those workers are of the workers who work in that particular area of the hospital, and what is the impact on staffing and services at the hospital?
Do you want me to answer that? So I don't have the numbers in front of me, but I believe it was 30 or 34 healthcare workers were in contact with someone who was positive for COVID-19, which is the reason why we are implementing universal PPE, because so those people are those people who were in contact have been sent home to isolate for 2 weeks. But with the universal PPE, the purpose of implementing that is to keep staff safe and to keep their co-workers safe. And so we will be putting out some more detailed guidelines in terms of expectations on different units and the principles that we're following. But for now, that is the protocol that we followed to send them home.
And if you have 30 to 34 healthcare workers in one section of the HSC being sent home, on top of, I guess, a handful of security guards and people who don't might not qualify as healthcare workers, what is the impact on operations there?
Yes, well, it's obviously going to have an impact, but it does not mean that all those people have been infected. It's really more an abundance of caution to ensure that our staff are isolated, and we will watch for symptoms and follow the usual protocols. But in the future, with universal PPE and the ability to protect each other, that's part of why we did that, because the impacts are significant, and we have to be able to manage that situation. So that is the change in the PPE protocol.
Thank you.
Thanks.
From the Winnipeg Sun, Scott.
Hello, Scott Billick, Winnipeg Sun here. I guess maybe a question for Lanette. People keep asking, emailing, wondering why the PPE changes weren't implemented sooner, if it could have stopped what is happening now. What is the message to that, and why maybe wasn't it done sooner?
So we have been planning since February, actually even before then. Our incident command has been in effect since February, and we have a series of mitigation protocols in place where when we need to escalate, we will. And up until yesterday, we did not see community spread. We saw travelers, and we saw contacts of travelers. So as we now see community spread, we have to increase our attention to this matter and make sure that we put all precautions in place for those who may have COVID that we can't tell ahead of time. So it's really the community spread was the factor.
Okay. And just to follow up, going back to Riverview, are you saying that there's no other? I've had reports that people, staff have been sent into self-isolation there. Is that the case, or obviously there maybe not be a spread among patients there, but have staff been sent home?
So I don't have the numbers on the staff. What I was focused on was that because of all the measures that were in place, there was no other clients that were considered contacts. So the staff, I don't have those numbers.
Okay, thank you. From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders at the Free Press. I'm just wondering about something one of the leaders of one of the hard-hit areas of Italy said. He said, quote, "The biggest mistake we made was to admit patients infected with COVID-19 into hospitals throughout the region." Would there be any benefits to opening a separate temporary hospital for non-critical COVID-19 patients? Is there anything that
That's a really good question, Carol, and our planning teams have considered that option. When we look at the number of critical care beds and the number of medicine beds that would be required in a worst case scenario, we didn't really see that being able to be situated in one hospital itself. But the principle is right, that people need to be isolated. We don't want COVID-19 people scattered throughout all hospitals and all units. So my understanding in speaking with our teams who are working on it is that there will be HSC, St. B, they are looking at dedicated COVID-19 wards where they would be conjugated in one spot. And that would go, and the planning that we're doing is provincial planning, so there have been conversations with Brandon and other sites as well. And Grace, I should say, too. So the concept is that we can't really have it all in one site, but we can certainly have them all united on one unit so that the staff are concentrated there.
And my follow-up question is, why didn't public health advise the public about the possible exposure to our city liquor mart? Why did people have to find out through the union for the workers and the MLCC?
So public health will, announce an exposure to if there is a confirmed case that we thought there had been prolonged close contact with, and so it will depend on the investigation of the case. If there was a confirmed case, then and it was thought to benefit the public to announce that, then it would have been done.
From the Brandon Sun, Drew.
Thank you. This is Drew Main from the Brandon Sun. It's a question for Ms. Siragusa, but in the fall, the province announced the clinical and preventive services plan. Just wondering whether you know at this point what the pandemic means for the implementation of that plan.
That's a really good question. So in some ways, the work that we did with that provincial clinical and preventive plan were so beneficial for the work that we're doing now, because we are really, for the first time ever, planning provincially as opposed to planning independently region by region by region. So through our incident command, we are putting out guidelines that are applicable for all, so that those regions don't have to do independent work by themselves 5 times. So there also was very much a vision for where we wanted to go, and a lot of things that are happening with the pandemic are really moving some of those things forward, like virtual care and different things like that, like provincial standard clinical guidelines. So right now it is all hands on deck. We are in pandemic mode, and most of what was normal for us, we are not doing. As Dr. Roussin says every day, it's not business as usual anymore. It's all about COVID-19. So I'm going to say that the implementation of that plan is going to be pushed out until we get past this COVID-19 crisis. But a lot of good things are happening that are very much aligned with that for the future.
As a follow-up, a part of the plan was bringing more services, including surgeries, to Brandon. I'm just wondering what the status of that is. Is that also being pushed back?
Well, you know what, now's not really the time to be introducing new procedures and equipment and training of staff, so that will have to hold. But what is happening is that when we're planning for critical care capacity and we're planning for community and public health, Brandon plays a very important role with a big, large space in the western part of the province. So we're not going to put new things in place, but we're going to do everything we can to enhance what's there and make sure it's a really strong partnership provincially.
Thank you.
Thanks.
From Global, Brittany.
Good afternoon. It's Brittany here from Global News. A letter went out to families and support persons at long-term care facilities on March 17th about the first cases being identified here in Manitoba. When was that case actually identified in Gimli at the Bedell Care Home?
The of the healthcare worker. So that
Yes.
one. So it's only of a healthcare worker, and that was reported to me yesterday.
And we've heard from a number of healthcare workers here who, like Ms. Siragusa's letter, saying that, it is their job and they're going into work every day, but a lot that are saying enough isn't being done to protect them, and why are these PPE protocols only going into effect now, along with the ones that are self-isolating at home being told that they're going to have to use sick time and unpaid leave to cover this 14-day self-isolation period?
So, Brittany, the principles of infection prevention and control are always the principles. They're universal principles. Most people learn that in school. If there was any concern about PPE being available, I would certainly, and going forward as well, that needs to be raised to their managers and direct reports. We have been shipping out a lot of PPE to different places, thousands and thousands of orders. So if it's not available, or if there's questions about what do I use when, that's fine. This is a new situation. We've been trying to be transparent with the information. There's information specific for healthcare providers on our website. There's videos. So, and maybe that's not trickling down to the frontline staff. So I would suggest if you have any questions or concerns, definitely talk to your direct report, your manager, and we can make sure that's resolved, because I've said it before and I'll say it again, our primary priority, our number one priority, is to make sure that staff are safe and the public is safe. So if there's any gaps, we want to hear about them.
From CJOB, Diana.
Good afternoon, Diana Foxall from 680 CJOB. With regards to the possible outbreak at the care home, those tests haven't come back yet, so I imagine anyone who is in hospital wouldn't be accounted in the numbers for COVID-19, but is anyone from that care home currently in hospital being treated for the respiratory illness?
Not that I'm aware of. I believe all 9 of the symptomatic clients are still within the Bedell home right now, and we're pending results. That facility has implemented their outbreak protocols, and isolation is in place to ensure no further spread.
And then just as a follow-up, with the new screening processes in place for people working in hospitals, how long is it taking them for them to get through to get into work? And should they be coming in earlier? We've kind of heard of up to 45 minutes to get in the door in some cases. Are you considering opening up more entrances for screening, or are all entrances being used already?
That's really a decision of the people who are working at the site, the leaders at the site, as to how they can best operationalize that. If they need to buy more thermometers or have more volunteers or open up more doors, we leave that to them to decide based on their individual operational needs.
From City News, Stephanie.
Good afternoon, Stephanie Westwood with City News. Just wondering, MP Nikki Ashton is raising concerns over a lack of testing in the north, even for people who say they were in contact with a confirmed case. Why would this be?
Well, our testing protocols are provincial wide. So somebody who has been in contact with a case who's symptomatic should be tested. And so I can't speak to any specific, specific concern that somebody had. But if someone was a contact to a case without symptoms, they shouldn't be tested. It's not a reliable test. It's not a useful test to test people without symptoms. So I don't know about those specifics. But testing is available in the north. We receive samples from the north. And our testing protocols are the same province-wide.
And then just, is it true that healthcare workers who were possibly exposed at HSC do have to take sick days or unpaid work time right now while they're self-isolating for 14 days?
Yeah, my understanding is that they would use their sick time, or if they have banked overtime or whatever they have, they would use that first. And then there's a process they follow through human resources to ensure that they are not deducted and they can still earn while they're at sick. So that process is through HR.
From CDC Manitoba, Bart.
Dr. Siragusa, you mentioned, Department Chief is here at CBC, you mentioned 30 to 34 healthcare workers at HSC. We're told 40 nurses plus doctors plus security guards. There are also people in isolation at Selkirk, at Grace, at St. Boniface. Where do you find the staff to pull in to cover off all these missing people at multiple hospitals?
Mm-hmm. So I received a report last evening and they were still working on it. So that's where the discrepancy in numbers are with HSC, but I knew they were still looking. How do we find, well, you know what, as we've spoken before, there was capacity, there were vacancies in empty beds at the hospital, so they are going to have to reorganize themselves based on the needs of the unit and the hospitals. It's not easy, and it's something that we want to actually address very quickly, which is why we put the universal PPE protocols in place today, as well as the screening. So we do not want our staff to get sick or be exposed. So we have that in place now, and the sites will manage and will do what they have to do to make sure services continue on a site-by-site basis.
Can you comment on the use of shadow scheduling for doctors and potentially changing the 14-day quarantine for workers in the event that you continue to have workers isolating?
No, I cannot comment on that at this time.
And not even on shadow scheduling? I mean, I understand that at HSC yesterday you had an entire shift of doctors able to come in and replace the existing shift of doctors because there was some pandemic planning in that extent. Is that correct?
You know what, I'll have to get back to you on that, Bartley, because we have been talking about that. That hadn't been raised to me previously, but I'll get more information about it.
I appreciate this is all changing. It's just questions we have. Thank you.
No, good question. Thank you. You keep me on my toes.
From the Selkirk Journal, Brooke.
Good afternoon, Brooke with the Selkirk Journal. Thank you for the opportunity. Dr. Roussin had mentioned cases in rural Manitoba. The virus has now arrived in Selkirk and as well in Gimli. Possibly, was there a false sense of safety being in rural Manitoba where people live at distance between neighbors?
Yeah, well, I hope not, because our messaging was exactly the opposite of that, is that now is the time to change our day-to-day living. Now is the time for social distancing. And so that was really the why we don't feel it's important to list the specifics of a geographic area where it is, because it shouldn't matter to you. We want Manitobans right now to make that change. Stay home, right? Don't look and see if there's cases around you or the news. Stay home. Practice social distancing if you have to go out. So we certainly did not have any sense of that this would not be a Manitoba-wide issue, and we were articulating to all Manitobans to stay home, practice social distancing. It's your best way to reduce the spread of this virus.
Thank you. Just to follow up, I had an email from a resident in Winnipeg Beach concerned about seasonal residents. Now it's April, coming to their seasonal places throughout the summertime. Would you advise them just to stay put at their permanent resident, be that Winnipeg or where they're currently living, and not self-isolate in a seasonal location?
Yeah, where we are right now, this is not the time for travel. This is not the time for cottages or things like that. This is the time to stay home, practice social distancing. Like we said, another downside to things like that is should people get ill when they're away, they could put extra strain on limited already health resources in the less populated areas. So now is the time. Stay home, practice social distancing, and then we'll interrupt the transmission of this virus.
Okay, thank you, doctors.
All right, we have time for one more round of questions. Unfortunately, only one question. Oh, no follow-up. Okay, let's go back to Radio Canada and Ezra. Ezra? On to CTV Winnipeg and Michelle.
Hi, it's Michelle Gerwin from CTV. We're wondering about what advice do you have for homeowners and renters who have to have service people come into their houses to fix their cable, etc.
Right. So all of those occupations and procedures are all exempt from the public health order, and they can happen, and just practice that social distancing. So certainly nobody should be coming in who's sick, and if you're sick, you should try to avoid having somebody coming into your house. And certainly anyone who should be self-isolating or or as a case should really should really delay that unless it's extremely urgent. But lots of hand washing, keep that 2-meter distance. And again, dramatically reducing the risk of transmission.
From the Canadian Press with one question, Steve.
Oh, hi, Steve Lambert again from the Canadian Press. I've got a question about the new protocols for equipment. When you say expanded use of PPE, are you freeing up more N95 masks? Are you agreeing to some of the demands from the nurses union to have access to N95 masks when they deal directly in close contact with someone who may have COVID-19?
That's a good question. So the protocol really is a change from, instead of wearing PPE when you think you have or suspected COVID-19, we are recommending that you wear the mask, the surgical mask, the gloves, and the gown for all patients all the time. So it's not just in certain situations, it's all the time to really make sure that patients, staff, and coworkers all are safe. So with regards to specifically N95, we are continuing to recommend what the evidence tells us is that for aerosol generating medical procedures, that's when you need N95 masks, and those will continue to be available for any of those procedures as they come up.
From the Winnipeg Sun, Dot.
It's Scott Billick again, Winnipeg Sun. I don't feel like that I have had clarification. So when it comes to any healthcare worker off sick, they're off because they have to self-isolate. Why are they being asked to use their bank sick time, and then why, this is from the union, why are they not getting paid well off in self-isolation based on something that's happened through work?
Well, I think that's always been our protocol of how it works. So I think that's a HR discussion. I can ask more details, but that's just how I understand it's always been.
From the Winnipeg Free Press, Carol.
Hi, it's Carol at the Free Press again. Now that there's universal PPE, how long will supplies last? Can you give us an update on what sort of supplies you have in stock and how much more you need and when you expect to get more?
So the supplies are a dynamic, obviously, process. So we knew and we were prepared when we put this protocol in place that we would have enough to sustain it. Obviously, we weren't going to put it in and not have enough supplies. So there are enough supplies for the future. There's more supplies coming in, and we will make sure that those get distributed to the places they need to be delivered to.
From the Brandon Sun, Drew.
Thank you. This is Drew May at the Brandon Sun. Where exactly in the province are we seeing that community transmission? Is it just in Winnipeg or is it more widespread?
Right now, that's where we're seeing that early transmission in the community is in Winnipeg. Of the all of the cases that we've have information on right now, there's 5 that we can't link to travel or to a transmission chain. So you can see that the vast majority of our cases still are represented by travel or known transmission chain transmission. But those 5 as at present in the Winnipeg region are representing what we think is early community-based transmission.
From Global, Brittany.
Good afternoon, Brittany Greenslade from Global. Another question on the PPE. A memo sent out by HSC to workers last night saying that the changes include, quote, masks and eye protection are no longer required to be doffed between patients, should only be doffed when wet, soiled, or damaged, or at the end of your shift. Is that safe for workers to be using one mask and one eye protection for the entire day through multiple patients?
Well, when you think that we're going to be now grouping the COVID-19 patients together, it will be going room to room with the same virus. So the risk of infection to the patient, if they've already got it, is decreased. And really, it's a good question, but the biggest risk to healthcare providers is in the donning and the doffing of the personal protective equipment. So evidence would show you that if you do not take off that gown and mask and gloves the right way, even if you wore them all day, you could get yourself infected if you don't take it off properly. So that's why it is really important to follow those infection prevention and control principles. Look at the website, watch the videos, but it's safe. It's safer to have it on than to take it off multiple times a day. It's actually a decrease in risk because of the reduction in donning and doffing.
Thank you.
From CJOB, Diana.
Good afternoon, Diana from CJOB. Just to follow up, as far as the backlog of tests that is now cleared up, the results are getting turned around in a timely fashion. How would that be possible to speed up even faster, and is that doable here in Manitoba in the near future?
Yeah, I don't know if we're going to be able to speed up necessarily that turnaround time. There's a lot of processing of the samples that needs to take place, but what we are trying to do is increase the volume, and so there's still plans to try to increase that volume even more. But I don't know if it's all that feasible to go much below that 24-hour turnaround time. And when you're receiving samples at multiple times during the day, you're looking at that 24 to 48-hour turnaround.
Thank you.
From CBC Manitoba, Bart.
Bart Mateva, CBC. In Ontario, they identified one of the vectors for COVID-19 were nurses and other healthcare workers who moved between healthcare facilities, worked in one, went to work in another one, shared. What is the province's policy right now on workers moving between facilities? And if it's still taking place, will it be stopped and when?
Yes, they do go right now between place to place. That's their common usual process. We have asked them to look at identifying who can stay in one place, and so they are working through that. Ideally, that would be as soon as possible. We just need to get in touch with the workers and make sure that we give them a choice and make sure the needs of each facility are addressed. So that should be coming soon.
Thanks.
From the Selkirk Journal, Brooke.
Hi there, Brooke Jones. I received an email earlier this morning from a resident in the Interlake who is making her own homemade masks with 2 layers of cotton, and she described your advice to people taking things into their own hands in terms of making personal protective equipment.
Yeah, so I think the big message is that if you're concerned about COVID-19, stay home. Stay home, practice social distancing. That's my advice to everyone. As far as homemade masks go, you know that they may not be providing the protection that you think. They're certainly not certified. Benefits might be it might limit the chances of you touching your face if you're wearing it. Downsides are you might feel a unsubstantiated level of protection and not pay much attention to social distancing strategies, so that would be a mistake to it. And then as far as certified masks, those same qualifiers go. And then in addition, it's that those masks are much better utilized in the hands of our healthcare workers. So that's my advice. People, if you're concerned about COVID-19, like we all should be, we see our numbers going up. We see people in critical condition in our hospitals. Stay home. Stay home if you can. If you have to go out, practice social distancing at all times.
Thank you very much.
From CBC Radio Canada, Ezra.
Can I take Ezra's question?
We do have.
Yeah, sorry.
We have.
I can go?
Are you there, Ezra?
Yes, I'm here. Yes, I'm here. Can you hear me?
Yeah, we can hear you, Ezra.
Okay, thank you. So I wanted to ask you guys, do you have any information concerning the clinical tests that are being conducted concerning the hydroxychloroquine? And can you tell us if you guys got enough volunteers that you needed to go through those tests? And can you tell us where you are, at what stage of those tests we are? Is there any information we can share with the public?
Great. Well, thanks for that question. So this is a study on hydroxychloroquine, and it's open to those who are cases who are tested positive. Those are their close household contacts, as well as healthcare workers that are close contacts of COVID positive clients. And so the answer is no, we do not have enough volunteers for those studies yet. So they're certainly actively looking for more people to call to inquire about it. And so again, anyone who's a confirmed case or a close household contact of a confirmed case or a healthcare worker who is a contact of a confirmed case can call them at their website, covid-19research.ca. and very important study. We need this type of work being done to see if there are effective treatments. So thanks for that question.
Thank you for the input. And our final question will be from Stephanie at City News.
Stephanie from City News. Now that there is community transmission here and no backlog of testing, my apologies if I've missed something, but when will you open up restrictions on testing now to anyone who is symptomatic?
Yeah, so it's going to depend on how we see the demand right now. So you can see that we picked up on community transmission. So obviously the restrictions aren't totally restrictive because we are seeing people who weren't related to cases, weren't traveling, and that's how we know of community-based transmission. But with the increased numbers here, we're having a large priority for healthcare workers. Symptomatic healthcare workers, not necessarily those who are exposed, not necessarily those who've traveled, just all symptomatic healthcare workers we are prioritizing. And then again, those in conjugate settings, we're prioritizing First Nation samples as well. And as we see the demand change, then we may expand that to anyone who's symptomatic. But the messaging again is that testing is only one component of our overall strategy. If those individuals stay home when you're sick, then the testing is not that vital for that individual because they're staying home. They're not going to be spreading any virus to anyone, and so it's important to get to the basics. Wash your hands frequently. Stay home if you can. Certainly stay home if you're sick, but practice social distancing at all times. And then the testing is that other component that will help us find cases, get them isolated. But remember, everyone who's sick should be isolating anyways. And so it's just that one strategy, but we're continuing to try to up our capacity on that so we can open up the testing.
Thank you, everyone. That concludes today's media briefing.
Thanks, everyone.
Thanks.
Thank you.
Thank you very much.